So in this clip, I'm going to talk about potassium and calcium. So potassium, like I mentioned before, is associated with lowering blood pressure, and it also plays a role in fluid balance, although when I think of fluid balance, I usually think of sodium. Very important for nerve impulse transmission, and also plays a role in muscle contraction. So the food sources: fruits, vegetables, milk, grains, meats, and dried beans. Fruits and vegetables are the primary sources, and so a lot of people actually have a lower than optimal food intake of potassium when their diets are low in fruits and vegetables. The minimum requirement is 2,000 milligrams a day, but the typical intake is above 2,000, but less than the optimal intake of 4,700 milligrams a day. Now, hyperkalemia, hyper means high, emia means blood, and the KAL refers to potassium because the chemical abbreviation for potassium is K. But potassium levels can be too high. This happens with kidney failure when the kidneys can't excrete potassium to maintain potassium balance, and it will result in cardiac arrest and death. This is a huge concern for people with kidney disease. We monitor their potassium levels very carefully, and oftentimes they are put on potassium controlled diets. Hypokalemia is low blood potassium, and that usually results with excessive vomiting or diarrhea. Some people are on diuretic drugs, which are medications to reduce the fluid in the circulatory system or the body. Some diuretic drugs are used to help control blood pressure, and then some people with excess fluid retention, like with congestive heart failure, where you can retain upwards of 50 pounds of fluid, are put on diuretics. But most of the diuretics cause an excess loss of potassium, and low potassium can cause cardiac arrest and death. So the next mineral is calcium, abbreviated Ca. And it comprises about 2 to 3% of your body weight. Most is found in bones. There's some in blood, some in soft tissue, some in your teeth. You really typically absorb just about 30% of the calcium in food that you consume. Now, remember I talked about things that increase absorption of vitamins, which also increases the absorption of minerals. The absorption increases to 75% of your intake when you're pregnant or when you're a kid and need more for bone growth. An acid environment helps with the absorption. This is a problem for people on those antacid medications. They're not going to absorb as much calcium, and they are finding that people who are on those medications long term seem to have increased bone fractures. Vitamin D also enhances absorption. That's one of the functions of vitamin D. So things that influence the absorption of calcium: vitamin D, lactose increases the absorption, and then the acidic environment increases absorption. Phytates that are found in some high fiber foods decrease the absorption. It binds the calcium, so it's not absorbed as well. Excessive phosphorus intake, and phosphorus is found in a lot of sodas. It's also found in other foods as well. And then tannins, which is a phytochemical in tea, can decrease calcium absorption. The functions of calcium provide structure for bones, the mineralization of bones. It's important for blood clotting, nerve impulse transmission, muscle contraction, and then cell metabolism. I did research in this years ago when they were talking about calcium may help reduce body fat, or dairy foods may help reduce body fat. Calcium is a cellular, it regulates cellular activities, and one of the things it regulates is fat oxidation. It turns out that Calcium is not a treatment for body fat loss. It only affects body fat, just a tiny, tiny amount. Other possible roles, it could decrease the risk for hypertension or high blood pressure, colon, breast cancer, maybe. It may decrease the risk, it decreases the risk of lead toxicity in children because remember, minerals compete with each other for absorption. So if there's lots of calcium available, it will decrease the absorption of lead. May decrease the symptoms of PMS. That's really questionable. I almost took that out. And then as far as reducing obesity, that's kind of gone by the wayside, but for a while there was a lot of studies published showing an inverse relationship between calcium or dairy intake and body fat. But when they were implying that you could start consuming more calcium to lose weight, that just didn't pan out. The food sources of calcium, dairy products, kale, collard, mustard greens, calcium fortified foods like orange juice, tofu if it's made with calcium carbonate, canned fish with the bones. The RDA is about 1,000 milligrams a day for adults, and then it's more for older people, and then higher for people age 9 to 18, which is when you're accumulating a lot of bone mass. So the current intake of most people is below the recommended amount. Now, as far as calcium supplementation, it is recommended for people who don't incorporate dairy into their diets. You can get enough without dairy in your diet, but it is more difficult. Overall intake should be around 1,000 milligrams a day from supplementation, and it's better absorbed if you take it in divided doses than all at once. You won't absorb as much if you take it all at once. A general rule of thumb is it's recommended that you consume 3 dairy products a day. For every dairy product you're missing, take 1 calcium supplement, which contains about 300 milligrams of calcium typically. Take it along with vitamin D to increase the absorption. And calcium supplements can cause constipation if you take it with magnesium, and a lot of supplements come with calcium supplements come with magnesium and vitamin D. The magnesium will decrease the constipation. Okay, you don't want to take too much because that will increase the risk of calcification of tissues, including arteries, which could increase your risk for cardiovascular disease. More than 2,500 milligrams a day is considered too much. Now, the disease that's associated with calcium is osteoporosis, which is weak bones that break easily. So people at risk for osteoporosis, women more so than males, but males do get it. The older you get, the more likely you are to have it. Thin people, because weight actually stimulates bone mineralization. People who smoke, Caucasians and Asians are higher at risk than other ethnic groups. People who are inactive, because if you don't lose bone, you lose it. People who drink excessive alcohol because it's lost in the urine. So there's 2 types of bone. One is trabecular bone. It's looks like coral. It's found at the ends of long bones and in the vertebra, and that's the bone that loses calcium most easily and is at greatest risk for problems associated with osteoporosis. The cortical bone is in the shaft of long bones, and it's pretty compact and dense. It doesn't lose calcium as easily. So an important concept is peak bone mass. You achieve peak bone mass sometime in your 20s, as you can see in this graph, and you start losing it about age 45 as a natural process of aging. You can see that men accumulate more bone because they have bigger skeletons than women in general, and that for women, there is an accelerated period of loss of bone, and that's like the 5 years after menopause. So there's a certain area where there's a risk for a threshold for fracture risk. Women will reach that threshold risk earlier than men. This is a picture of a DEXA scan. That's how bone density is determined. This is the lumbar spine. Since vertebrae are mostly trabecular bone, the spine is affected severely by osteoporosis, and so are the hip bones, the femurs. So this is a picture of healthy trabecular bone. You can see that it's a nice thick network, and then in osteoporosis, you can see how the network has thinned out. So crush fractures are common. That spongy trabecular bone will just collapse, and that's why people with osteoporosis get shorter, because their vertebra collapse. So here's a picture of a woman with osteoporosis, and you can see the deformity in her spine because of the collapsed vertebra. So this is a person as they age with osteoporosis. It looks like their arms are really long. This happened, my mom had severe osteoporosis, and it was actually her cause of death, because she went in for a surgery to fuse some of her vertebra that had collapsed when she was 78. And when you're elderly and frail and go in for surgery, you often go into multi-system organ failure, which is what happened to her. But this is a characteristic body shape of someone with osteoporosis. So to prevent osteoporosis, you want to achieve peak bone density in your early years, and a lot of y'all still have time for this, by meeting your calcium and vitamin D needs. If you're female, you want to make sure you have regular periods, because irregular periods are a sign of estrogen deficiency, and estrogen is needed for bone mineralization in women. Don't smoke, don't drink excessively, meet your protein needs, because protein is a component of bone, and weight-bearing exercise to put some stress on your bones, because stress on your bones will stimulate bone formation and calcification of bone. Okay, so some other notes on osteoporosis. The mortality rate of osteoporosis is about 12%. You don't think too much about osteoporosis. You really think about, the hunchback or the breaking of the hip. But the people with osteoporosis are often in massive pain. So this is something that you do want to do your best to prevent.